Hello and welcome to the NIGP webinar, Navigating a Disrupted Workforce, a discussion on procurement's role in the COVID-19 pandemic. Presented by Andrea Filial and Stacey Adams. Rick has served as NIGP CEO for 22 years. He holds a bachelor's degree in business administration from the University of Miami and a master's degree in public administration from Florida International University. He's served county governments and public school districts for 23 years, including over 12 years in the management of the public procurement function, before joining the NIGP team in 1998. Carrie has over 20 years of procurement experience in both the private and public sectors. She currently serves as the manager for the Orange County Procurement Division and is responsible for approximately $600 million in annual contract awards. Jack Pellegrino has over 34 years of government contracting and procurement experience working with diverse teams of contracting, procurement, and pricing staff in both the public and private sectors. Linda has almost 30 years experience in procurement within a variety of agencies. She is currently a director for the Canadian Public Procurement Council, a member of NIGP's Purchasing Finance Committee, and an NIGP instructor, and a past president of the Ontario Public Buyers Association. Stacey is the Deputy State Procurement Officer for the state of South Carolina, Division of Procurement Services, managing the state term contracting teams. With nearly 20 years of experience, her skills represent governmental purchasing at the county and state agency and statewide levels. Andrea is the Procurement Director for Loudoun County Public Schools and has been with the LCPS for over 20 years. She holds a degree in Business Administration from Strayer University and is Certified Professional Public Buyer Certification. If at any time during the webinar you need technical assistance, please let us know in the Q&A box. During the presentation, you may submit questions to the Q&A box on your screen, and we will take them during specified parts of the presentation. Rick, would you like to go ahead and get us started?
Yes, Justin, thank you very much. And thanks to all of you. We got close to 500 of our wonderful public procurement professionals who are joining us on this webinar. It's great to see all of your hello, good afternoons from sunny everywhere, from Florida over to Washington, just all parts of North America, both in the United States and Canada. I know these have been very, very difficult times for all of us who really are committed to serving the public entities that we are employed with. And even though we come from different areas, obviously this issue of COVID-19, how it's impacting the work we do in a disrupted workforce is so important. And so as we gathered with the NIGP staff, we talked about this opportunity to bring a panel together, people who have a diversified expertise to kind of really talk about three particular themes that we want to really focus on. How have you moved your office to remote work? I doubt that many of you are still in your physical offices. You're probably working remotely. How are you doing that? How are you keeping the fires going? And then how are you maintaining that procurement function remotely? Everything from bids and contracts to receiving. We're going to talk about that area as well. And then how do you serve your constituents and first responders? How are you doing sourcing? How are you handling emergency purchases, et cetera? Now, our game plan really here is to ask our panelists, our panelists of 5 individuals that Justin introduced, a series of questions. And what we're going to try to do within each of those 3 theme areas is to take just a little bit of time, see if we can field any questions and answers that you pose on the chat box. So we'll be glad to help you with that. But I realize we have a lot of ground to cover, so let's move forward. Again, thanks to Stacey and Linda and Carrie and Jack and Andrea, all for being panelists this morning, coming from a very diversified backgrounds, everything from provincial governments to state governments, cities, and school districts as well, covering the United States and Canada. So hopefully we'll have a great conversation on that. So we talk about moving your office to remote work. How are you bringing these teams together? Stacy, why don't you kick it off for us? How are you bringing you cover a very, very large area of the state of South Carolina. What tools are you used to bring the teams together? How frequently are you doing that as well?
Well, thanks, Rick. And the first thing that I would say about that is change management is key, and understanding who your teams are. Not everyone handles this the same way. For the introvert, this is like, yes, this is an exciting time. But for our extroverts, this is torture. So it's really important that you know your team and how to help them adjust during this time. And so while conference calls and emails, those are awesome resources, but they can leave some of your team feeling a little bit impersonal and isolated and alone. So one of the things that we have been trying to do is, in addition to those conference calls and emails, is to consider video calls. They're a little bit more personal, and it does allow you to monitor some of those nonverbal cues that you wouldn't necessarily pick up over the phone or without the help of that visual tip to help you along. And that really helps you to monitor how everyone's doing. Our teams right now are using the free Zoom platform at the moment. Zoom has waived the 40-minute limitation during this time as well. We're finding that that's working very effectively for our teams. We also have some WebEx that we're utilizing at this point. We're also trying to look at some creative ways too, and recognizing that we needed to create an environment that allow for some of those non-work banters, if you will, or some water cooler conversation. So we're also using some instant messaging and collaboration space so that our team can relax and maybe share fun moments or pictures or even memes or files in a less formal environment. So we're using the platform right now of Slack, which again is free, but it's not part of our normal routine day-to-day processes, but it is something that we're experimenting with as we're all having to kind of adjust and figure out how to do things differently. We are meeting as a full team, at least on a weekly basis, and then as smaller teams throughout the week. We're using the instant message platform for each day. We have our good mornings, have a great day, and at the end of the day, how's it going? How did your day go? Type conversations. So we're really trying to keep communication constant and not just on the calendar, we're going to speak for this 30 minutes of our week.
So agility, change management, finding creative ways to bring people together on a regular basis, just kind of a check-in. We're doing that at NIGP. We have a check-in with all staff. It was actually this morning, again, using Zoom. So I could question what the other panelists. Derek mentions as a participant that his team is using Microsoft Teams. Anyone else on the panel that's utilizing Microsoft or a product other than, or platform other than Zoom that you have found very effective to bringing these teams together?
Yeah, hi Rick, this is Jack, and I won't repeat anything that Carrie said, but we use WebEx, and also we are going to be implementing on our enterprise-wide, because across our whole, we're moving the Blue Jeans, a product called Blue Jeans. But to emphasize what Carrie said is, for my organization, we were very fortunate, and since we had emergency responses before in the unfortunate fires we faced in the past years, my entire team, procurement team, all 47 folks had full laptops capability and cell phones. And so what we've migrated to as far as a day-to-day communication is more cell phone than our normal work lines. And our work lines are forwarded to our cell phone platforms. But we're meeting, like I'm the logistics chief for our emergency response for the county. And I have a team of my half a dozen key staff that we're here all time, full time. The rest of my staff's working remotely, but we found that using cell phone at this time, messaging, which was mentioned, and we just had our first video conference call yesterday where everyone was on the screen, and it was to emphasize that was what was said. It was great to see the body language and people in their home work environment, whatever that might be. So that was very helpful to kind of bring us back together. That's all for
right.
me.
And a lot of our participants have used. A lot of them are using Teams, Google Meets. I'm seeing Jabber. A lot of opportunities to bring folks together. But it's not only just bringing those teams together, but how do you manage that project? How do you manage the workload, bringing your groups together? Andrea, what's your experience at Loudoun County Schools? That's a fairly substantial school district. How do you manage projects in this time of remote work?
Well, basically, as we've just started, we have online learning starting for our 83,000 students. And one of our biggest purchases when they first announced this was 15,000 Chromebooks. As you can imagine, I think our superintendent said at one point there was only 16,000 Chromebooks available in the country, and we needed to purchase 15,000 of them. So from a procurement perspective, I think COVID-19 itself is a project to be managed. It has really, for us, since we're not really impacted by hurricanes, fortunately no fires, we haven't had any tornadoes, this is a huge undertaking for us as this is some uncharted waters that we're getting into. In regards to the workload issues, what I found is we've got some people that are extremely busy and some people that are sort of busy. One of the things our jurisdiction has done for those individuals that may not be as busy as others is allowed us to offer online training options to our staff to give them an opportunity to take those courses and things they haven't taken before or haven't had the time to take. Like Stacy, we're doing the regular check-ins. I have a weekly check-in with my staff. We use WebEx as well as Jabber. And also we're starting to use more of the Google platforms because of our educational aspects utilizing Google for their teaching. So from a workload perspective, it's just a matter more of trying to make sure everything's getting done, the solicitations are getting out, the contracts are getting reviewed, and getting everything back in a timely fashion.
And Andrea, what platform are you using for project management?
For our project management, we're not really using a platform per se. Project management is another one of those areas where there's like 4 or 5 of us that have background in project management, and we're using whatever tools work best for us. One of the main things with project management with something like this, really, in all honesty, the best way to manage the project is the communication. The communication that takes place with myself and my staff, as well as myself and the fellow directors in my business and finance department. And then my assistant superintendent has daily meetings with the other assistant superintendents to review the next steps. As you can imagine, they're in a meeting in the morning, come up with their next steps, and by afternoon, those steps won't work because something else has changed. For instance, yesterday, Virginia was issued a stay-home order. So that changed everything we were looking at, and that is currently in effect till the 10th of June. So what does that look like?
Yep. By the minute, isn't it? Changes it by the minute. Yeah.
Yep, and that's
so
what,
I think
yep.
Yeah, go. I'm sorry, Andrea.
No, that's what I was going to just say. Stacy was saying the biggest thing in project management, one of the biggest aspects of this is change management, because this is ever changing.
Right. I absolutely agree. The other thing is that we're used to being in an office environment where we can see people, we can check in, we can also kind of manage workloads that way. And when everyone is remote, it's difficult to kind of play that supervisory role. And so, HR issues also come to play, right? How do you make sure that people are taking sick leave if they need to do that? Or we're going to talk a little bit about how we support our staff from a mental health standpoint, but from an HR standpoint, just everything from recording time and payroll and stuff like that. This is a huge issue, particularly if you have a larger staff like Carrie in Orange County, Florida. So how are you, Carrie, dealing with these HR issues?
So we have adjusted just like everyone else. We've had to be very flexible in terms of our operations, in terms of how we're kind of managing staff and making sure our workload is getting done. And at the county, we didn't have any sort of telework program at all countywide. So that was something that was not documented. We didn't have program documents. We required, we really relied on the guidance that HR gave us in order of thinking about how we're going to manage our operations from a staffing perspective. So we relied heavily on their guidance. We had to do just kind of a division-wide assessment, position by position, to look at everybody's job descriptions, understand the functionality that they had to be able to telework, and if they actually had the technology to do so, because a lot of us didn't, and so that's another flexible area. But what HR really kind of focused in on was making sure that all of the team members that would be authorized to telework, understood the expectations, and they wanted us to be clear in terms of the expectations. So our telework program documents had to have detailed work assignments for each authorized position. We had to spell out reporting deliverables so they understood what they needed to report on, when they would need to submit those reports, so that we could really kind of oversee from a supervisory perspective and make sure that they understood what the requirements were to be able to work through this program. And we had to provide that documentation back to our HR folks. They've really been a good partner for us. HR required all of our folks teleworking to execute a formal agreement between myself and that team member. It outlined all of the accountability expectations and included things like authorizing timeframes for which the teleworking would be in effect, what the expected hours would be for them to actually be teleworking, and it also covered some of those protocols, such as handling payroll and what those responsibilities are. We use our payroll system as an automated system of Kronos anyway, so people have the ability to go in and adjust their time. But based on those telework agreements is when we're really kind of capturing and validating that they're spending the time that they need to be on the work. Sick leave, according to HR, is something that still goes through the normal process. So if for some reason somebody's sick and not able to log on and do their telework that day, they have a responsibility to still request consideration for use of personal or sick time from their supervisor. So it's not a given. They still have to follow the same process like they always have, even when we were back in the office. And then a final component kind of outside of those were, how do we handle things like staff who may have traveled to an area where it might have been considered, you know, an up-and-coming hotspot, if you will? Or how do we handle staff members who might have pre-existing respiratory conditions? What do we do to support those people? And so the connectivity between us and HR has been kind of constant, because we want to make sure that we're addressing and supporting our people, relying on them to tell us how to navigate and handle these unique circumstances, because these are new to all of us. We wanted to make sure that our staff was safe. We wanted to make sure for their benefit, but for the benefit of others in our office as well. And so we really consider them a partner throughout navigating, standing up a telework program, and how to really handle unique support for each team member, regardless of if they were going to be working remotely or in the office, how to kind of handle those health concerns they had.
Again, the interesting part at the beginning of the conversation, Carrie, is that you were not an organization that was practicing teleworking, and now talking about change management, automatically having to move into that. So how did you build these policies? Did you grab them from another entity that had already developed a telework? How would an organization start if they weren't doing teleworking initially to kind of get you to this point in time?
So I'll be honest with everybody that's here on this webinar today. I was at the EOC, Emergency Operations Center, last Saturday, and I dedicated the entire 12 hours when I wasn't having to source or do other things. As luck would have it that day, it was kind of slow considering, and so I built it. I built the whole framework. I didn't have another telework program to rely on. I worked on the guidance that HR gave on how to kind of structure one, and I just built it. Of course, I had my assistant manager to kind of bounce things off of. I wanted her to review it. I wanted to make sure that we were capturing the essence of every single work assignment, but it really needed to be tailored to what our HR office was requiring to be included in that program document.
Yeah, so this may be an area we can work on as NIGB looks at resources, maybe sharing telework policies for those of you that are that are really kind of struggling to get a footing on that. Let me take one last issue as it relates to kind of the remote work, and that's that whole issue of mental health. So Stacy, maybe, I don't think this is true, by the way, because I know Stacy pretty well. She said, you know, if you're an introvert and you really actually thrive on being by yourself, I am just absolutely the opposite. I am an extrovert. I got to be with people, among people. This has been very, very difficult. And I think, you know, a lot of us are in that same boat. How do we deal with this whole issue of supporting staff's mental health? Because we are, in many cases, we're the first line responders. We're the ones that are out there buying the mask and the respirators and all the equipment, and someone's got to take care of us as well. So, hey, Jack, what's your experience on supporting your team in terms of mental health?
Well, you know, one of the things that we're fortunate here is in San Diego, we have a very robust employee assistance program. And also we, for the last 3 years, have been spending a lot of energy in the community as far as mental health. Our budgets, I think our budget for the mental health side of our Health and Human Services has increased something like 46%. So we are really now making sure that our individual employees are not only aware of the employee assistant program, but also, like all of us, are residents of the county. And all those resources are available to us individually. That includes the crisis call-in lines. And also what was mentioned earlier by the panelists is the things that we can do as leaders and supervisors to keep our staff as comfortable as they could possibly be in this very anxious time. And that is simply by personal contact. So that's how we're kind of addressing it here.
Yeah, excellent. And Linda, I know from a Canadian perspective, you actually worked in the specific area of mental health in Ontario. What are your thoughts about how do you support mental health in these very difficult times?
Well, actually, there's a number of things. I was at the Center for Addiction and Mental Health actually during the SARS crisis in 2003. So kind of to some extent been there, done that, although SARS was not what C-19 is. But the thing now that's happening is supporting people in not having to go home. So for example, I live near Peterborough, Ontario, about an hour east of Toronto. Trent University is here. Trent University is using or has offered one of their residents to healthcare workers so that those healthcare workers who are in daily contact with people who may be infected with C-19 don't have to go home to their families. Now it's you know, an issue with them not going home, but on the other hand, they're also concerned about taking it home to their family and their friends and their kids and their elderly parents and everything. So that goes a long way to supporting them, and Trent University just offered it up. I don't know that they were requested to do that. But when I was back at the hospital, we actually, I called it dorming people, because I actually brought in external equipment to be able to house people outside of the hospital facility. They were actually on the grounds. I used a combination of, you know, the movie set trailers and RVs. And people stayed in those, especially if they were critical to the operation and they kind of had to stay on site, or they were expected to be there in, say, a 24-hour shift instead of a normal 8 or 10-hour shift. And that was a real support to them, aside from the fact of saying thank you every chance you get, because these folks are in the front line all the time. So, you know, having that thank you from people in recognition of themselves, putting themselves in the line of fire, whether it's healthcare or first responders or paramedics or, you know, whoever they are. And in our case, government staff as well, because we're out there sometimes where people don't necessarily recognize that. So I think it's a big thing of being, just being aware of what people are actually doing and saying thank you once in a while is a huge, huge morale builder, that they get that recognition.
Totally agree. Totally agree. 600 of you are now a little over 600 are you participating in this webinar. We're absolutely thrilled by your turnout. I know that this whole issue of how do you cope in an area of uncertainty is really critical as we deal with the remote work. I'm watching the Q&A box of the webinar, and I know most of you are really keenly interested in how are you managing that procurement function remotely. And so I really want to go into that area, and then we'll try to bring this back to a Q&A at the end of this session, or this particular topic of the procurement function. And by the way, I believe Justin is recording the audio, so you can pick it up after that, and he'll send it out after this webinar is over. And of course, we will have the slides for you as well. So, one of the issues that we're thinking about when you got to continue to perform the procurement function. I got a call from a reporter who says, well, obviously procurement's not doing anything because none of you were in the office. And I said, well, that's absolutely not the case. Procurement is really the tether that makes governments run by buying goods and services and keeping organizations afloat. But how are you doing that within the context of a remote? How are you utilizing technology to make it happen? But I think it really kind of starts with this whole issue of how do you look at the legislative process? How do you create some agility within your policy? How do you create waivers? How do you deal with emergency procurements in this very, very uncertain times? So Stacy, how are you dealing with this particular issue of agility and waivers and emergencies?
Awesome. Well, before I dive into that, I want to make note, because I'm seeing a lot as a panelist, a lot of people are commenting in the chat box as well, but you're only selecting all panelists, so that we as the panelists are the only ones getting some of this awesome feedback that you have. So be sure that you choose all panelists and attendees if you want to share your ideas with the whole group. Because there's some phenomenal things coming here that there's no way as a panelist we could share them all. So if you would just make that change on who you're sending it to, it would be awesome, because you guys are really doing some great things across the nation. Now, that being said, I think the key thing that you have to start with, as we've had communications with different people across the state, and you ask them, well, what is your emergency policy? What are you doing? And they hand out just a day-to-day policy and procedures manual, but that is not the same as procedures for a declared emergency. And really communicating and expressing the difference between those two types of policies, because they're notably different, and understanding and knowing where they are and how they apply to you is really key. But also understanding that you can't make decisions in a vacuum. As you're going through and you're trying to collaborate and establish what's going, Carrie made a brilliant point on telecommuting. I know we personally didn't have a policy that was in place for that. So we found ourselves actually having to try to build the plane while we were flying it to come up with something to meet that immediate need. So we had to work with HR. We had to work with IT. And we had to be flexible enough to understand that, too, even once we put this policy or this procedure in place, we had to have ways to make adjustments and to be able to communicate that and press that down as it was necessary. But we found that, it was real easy to say, okay, everybody go home and telecommute. And then we start talking to IT and, okay, well, VPN and the ability to dial into our system, we're limited to a certain number of tokens that we have as an agency. So we can't just say, go home and work, and not everybody has, laptops. What about those with desktops? And does our policy say that you can take, assets home? And so really having to collaborate with IT and say, okay, well, how can we do this? And so we came up with different ways that, a certain level of management and team leads would have that VPN access, and we would collaborate with our teammates to be able to help meet their needs for files that they may not have access to, or to be able to, work around some of those policies that says, we have a policy for electronic signatures and there's some contention on that. And so we still have that little bit of archaic where you've got to print, sign, and scan. Well, not everybody at home has the ability to print, sign, and scan. So who has that functionality, and sending that to them and asking them to execute on your behalf, is something that we've had to consider. But yeah, there's a lot of challenges with that. Fortunately, with our state, our governor, and even our city councils have been very proactive and engaged in this process to react and communicate and allow changes as much as possible. But in so doing, they've kind of created some issues as well. For example, our governor, is promoting that social distancing and everybody's teleworking. But then our Columbia City Council declared an emergency order enacting a stay home, stay safe order that is recently effective. So while we have essential personnel that can receive bids in our office, we have our city council telling people you can't just go and drop off that bid. So we're having to adjust to even discrepancies on a local level versus a state level, and having to find ways to address that. So it's been interesting, but agility seems to be the word of the day when it comes to anything that we're doing in this season. Is be flexible, be agile, and just learn to adjust as well.
So Stacey, do you find that the more localized the entity, the more agile you could be? I mean, you've got your procurement policies are written in state statutes, which are almost impossible to change at a moment's notice. For those who are in kind of in a local area, maybe they can work with their elected officials to look at those kinds of waivers. But I think a lot of this depends on the type of entity that we represent. So I see a lot of the chat is on doing these pretty big conferences, and that you can't do them through teleconferences. You got to do them in person in the state of Florida. So I think that's kind of a challenge that I'm not really sure we have an answer for. But you have any thoughts on how you could change the actual legislative process during this period?
Yeah, and for some, you're absolutely right. That's an easier challenge than not in different places. And so knowing what your leadership and your city and town council will allow, and what your legislators, what's palatable to them, is very important. So fortunately, for us, and as you mentioned, it's different in a lot of places. Our governor, once he declared a state of emergency, we already had protocol in place that kicks over into that emergency processes and policies and procedures. So our office then signed a notice and in response to his executive order that says, okay, guess what? Emergency procurement authorization is now in place. And this is where you find it in our code of laws and how you respond to it to be able to expedite things during the state of emergency. So we had some things already in place to do that. But honestly, if you are in the midst of this and you have no groundwork established, I can't imagine how to do that and to turn that on a dime. I would love to hear from fellow panelists if you had that. Fortunately, we had a lot of things in place, but if you had nothing, government doesn't move that quickly. So if you're not at the local level where you could pull together city council or county council, I can't imagine that.
So if I may, this is Jack Pellegrino. We are a county that has 18 city jurisdictions within our county. We are the second largest county in California. But again, you have 18 different jurisdictions that are within us. The great thing that happened very quickly, I would say about 2 weeks, almost 2 weeks ago now, it was all about communication, and we communicated very quickly what we were going to do, and they followed our lead. They all issued emergency declarations at basically the same time, and they enacted the same policies as we did, and then we had very close coordination with the governor, and we are all aligned now. So the executive orders that have been, or the guidance that has come down, and the waivers that have been issued at the state level have allowed us to very quickly respond. And frankly, my elected officials here are all too happy to say, Jack, what do you need relief on? We have something called the Public Contracting Code here that was quickly waived. Our public records request requirements were delayed where I don't have to respond in 10 days until it's delayed until after the emergency. Even some other public meeting laws about, we call it the Brown Act, they were suspended. So it's really about many politicians at every level are willing to help. You just need to ask them what you need help in and be specific about that ask. And I have found that they're willing to help you do what you need to do to get it done, to get your support out there.
Yeah, and it appears as I read through the Zoom chat, several of you, particularly in Florida, have referenced a waiver from the governor that allows this telecommunication to happen in pre-bid conferences, which we're going to talk about in just a bit. But it seems as though that agility is happening not only within the procurement family, but also within the individuals who write the rules for us. So I think it's really important to think about how we're able to deliver our services as procurement professionals in this time of uncertainty. And of course, another part of that is the thinking about not only from a policy standpoint, but from an infrastructure standpoint. So how are we utilizing e-procurement technology? Do we have a platform in place, or are there systems that we can get quickly out there that may be free that will allow us to manage that if we haven't already done this? This goes back to Carrie's situation of you don't have a telework policy, but now you need one. Maybe you don't have any procurement technology, but now you need one. So, Linda, why don't we talk about your use of e-procurement technology, and maybe a kind of a subset of that is making sure you have enough bandwidth that's available as you do this thing remotely.
Yeah, that's a huge issue, Rick. E-procurement technology, there are a lot of solutions out there. Some agencies have implemented portions of them, but not all of them. Unfortunately, when you come to a situation like C-19, where either we're sheltering in place or we still have to be at work, but the majority of the people that we're trying to maintain aren't at work, remote access is a huge issue. And for that reason, I think one of the biggest things that's in the road is either governing bodies which have not provided the e-procurement technology dollars required to their organization to implement those solutions, or that they've only implemented part of them. Because when you get into a situation like this, you need the cradle to grave. So if you've got templates available that end user departments or subject matter experts can use to build their documents, that's great. If you don't have them, then I'd suggest you get on that right away if you haven't already. But we also need to look at posting on a platform that's accessible to everybody and being able to receive those submissions electronically. That's assuming, of course, that your legislation permits you to do that with or without signatures and dealing with, performance bonds and bid bonds and all the rest of it. So those are things to look at when you're looking at a platform. And some of them even go so far as to do the evaluation. I saw one of the chats here that said bids and tenders, and I know bids and tenders does the initial evaluation. So for example, if a bid bond is required and it's not there, it just goes, didn't make the cut, it's toast. Other platforms may do the same thing. But having that technology isn't the only thing. When you get people working at home, the bandwidth and their accessibility to technology in their homes is an issue. So even though the solutions may be available, they may not be able to access them appropriately. So you need to look at not only the remote access for your procurement teams, but also your subject matter experts for their document development, managers to be able to approve things, so online approval. It could even be line staff to put requisitions in, so e-requisitioning, or to manage a contract once it's out there. Even just some of the people in the chats here have said, they don't have audio on their laptops at home. It's little things like that that get in the road. Sometimes we look at the big issues and forget that smaller stuff that is kind of the bedrock that makes it work really well. And of course, the bandwidth, when I was at the hospital and we were looking at people having to work from home, it's the access that they had in their homes. Did they have a home office? Did they have the printers that could scan and fax? That was back in the days when we still used fax. Did they have, enough on their computer equipment that they could actually handle some of the files? So did they have enough RAM? Did they have to upscale that? Did they need a better data plan and all that sort of thing? And if they need that, how do you manage the payment and the reimbursement to that to put it in their homes? Because that's another huge issue, which is, part of kind of the HR thing perhaps on who are the critical mass people and who are their fallbacks if they disappear from the landscape for whatever reason. And aside from that, it's the training requirements and the remote support for those people who are now using that platform that may not be overly familiar with it. They may not be computer sophisticates. So when they're using whatever platform it is you're using, whatever technology you've got available, they're going to need some training on it. They're going to need some upskilling to get familiar with it. When you look at all the different applications that have been mentioned in the chat about just in communications alone, my goodness, aren't going to be many staff who are available with all or familiar with all of them. They may be familiar with some of them, and they may have used some like Skype, but they may not necessarily be familiar with Teams. So there's a whole learning curve involved there. And I guess the big thing is if for some reason, and it could even be with C19 that support staff who maintain the systems, if those systems go down, what do we do when they're not available? Do we go back to pen and paper, and can people actually do that? I've worked with people who go, oh my goodness, my computer doesn't work. I have nothing to do. I can't do anything. Well, pick up the phone, write it down. What are the alternatives if other things happen? And sometimes when we're looking at some of the technology solutions, we're looking at some scenarios, but we're not looking at the whole breadth of what could go south very quickly. What are the things that are the roadblocks that keep people from being successful? What are some of the things that they're going to be dealing with that's going to distract them? So the mental health issues are one of them. Using the technology to keep in touch is, I think, a huge benefit. Although some people, if you're an extrovert, you want to actually talk to people. And I'm one of those folks that, yeah, you can text me if you want, but if I really want the details, I'm going to phone you instead. So all those different types of communications and how you communicate with them. And can people use some of this technology with the size of the files that we might be sending out? So even looking at beyond the procurement technology, what about data sharing applications? So whether you've got Microsoft Teams or you're using WeTransfer or Dropbox or whatever the solution is, they need training and support as well.
I absolutely agree. And Linda, as you were speaking, the webinar chat is just blowing up. I don't know, Stacey, you're more familiar with this than I am. Maybe we can find out from Justin how we can capture the immense amount of knowledge sharing just on this chat, because several of you have used solutions that have been very, very helpful to you, and to make those connections after we hang up today, I think is absolutely critical as we think about how we continue to serve our individual constituencies. I want to move over into talking. We're talking a little bit about the solicitation cycle and big openings and stuff like that. But before we do, Carrie, are you seeing an increased use of P cards as a means of addressing procurement in this uncertain time?
So we had kind of transitioned our strategy for use of P cards at the beginning of this fiscal year to allow it to be utilized more for services and things like that, where before it was prohibited. So we're constantly monitoring the number of transactions this fiscal year, kind of as a result of the changes that we had. I can tell you that we have one person that's dedicated to our P card program to manage the program. So she's teleworking too. She's actively monitoring that system to kind of take a look at the volume that we're experiencing, because we have to really consider not just the number of transactions, but are people in the proper profiles to be able to manage and increase utilization of the P card She's looking at profile limits. We have emergency cards out there. So we actually have a pool of emergency cards that are assigned to departments, not necessarily to an individual. And there's a custodian in each department that is responsible to secure and assign that card where appropriate. And so when those activations happen, then we increase the profile and make it available for someone to use. Other than that, the card stays stagnant at $1 to kind of limit the risk of that card, even though it's secured. So we have 650 cards that are out in the county at any given time for use, and then we have a pool of emergency cards. So we have a separate program document that facilitates allowing those emergency cards. Consider if you have public safety folks that might have to go out on a strike team for a state deployment and things like that that don't usually have a card. So we developed that strategy to accommodate for those instances. So our person is managing the profile limits on those emergency cards. She's making profile changes to existing cards. So in times of emergency, we do have provisions to increase the profile spend limits on those cards to account for the emergency situation. She's working through password resets, card deactivations if people leave, ordering new cards. We're kind of still trying to maintain that program as much as we can. But in terms of the usage, we had to kind of look at where our credit line was. And so we have a procurement card program, and then we have a travel card program. And so there's two separate sets of cards, two separate credit lines that aggregate into our total county credit line. And so we had to take a look at that and say, hey, right now travel's restricted, so nobody really should be using those travel cards. Let's move some of that credit line over into the purchasing card credit line to beef that up so that we have you know, a sufficient credit line available for that what we anticipate to be increased use. So think about those credit lines if you kind of have separate ones allocated for each of those card types. And then also we're thinking about our strategy for if we're going to use these cards as a form of payment rather than to affect purchases. We haven't in the county been really using those cards to pay invoices and pay vendors, things like that, more of the smaller dollar purchases and small service purchases and things like that, but as a strategy to affect payments in the event that our fiscal folks might, you know, if they shut down and they don't have the ability to be processing checks, how can we still keep people getting paid? And so we have to kind of now think about that strategy and what do we need to do to work with our banking system to, again, be flexible and consider that we might need to shift and have an increase to our credit line as a whole to be able to affect payments. And if we do that, then that's a whole other increase to the cards. But then we also have to think about that some vendors just may not accept that form of payment. Some vendors just don't want to take credit card, or they're going to assess an additional fee to be able to process that payment. And so then you have to go into the cost-benefit analysis to really think about, is that an approach you want to consider? And maybe in these times where you have a limited workforce and less people that are in here doing those manual processes, it might be worth it just to pay the extra administrative cost to be able to get that purchase made or that payment made through the credit card rather than having to do manual check processes. So lots of things to consider in terms of P-card use.
Oh, you're not kidding. You're not kidding. Moving to kind of there's two 500-pound gorillas in this conversation. And this first one is how are you managing that solicitation cycle? A lot of questions about how you're handling bid openings, pre-bid conferences, purchase order processing. So I want to take this in kind of a two chunks. Looking for Stacy and Andrea to kind of give your perspectives on that solicitation cycle. Again, bid openings is a big question that's come from a lot of our participants from both a state, Stacy, perspective and from a kind of a local K-12 perspective from Andrea. So Stacy, why don't you kick it off and then we'll shift to Andrea.
Absolutely. And again, I'm going to do a plug because I was collaborating with Justin behind the scenes. The chat feature is set to save, but everyone has to use the all panelists and attendees when they send out a chat. Otherwise, it's not going to save. And there's been some phenomenal feedback that was provided regarding the solicitation cycle and the different ways that everyone is handling it. So if you go back and look at how you shared, you may need to reshare that with the whole group so that we can collaborate and push this information out, because I know we're running, tight on time and there's some great information. But fortunately, as a state, we had already had some things that were in place that allowed for us to do our pre-bid conferences either via conference call if we chose to do so, or via platforms such as Adobe Connect or WebEx, where we could share documents and interact that way. So that for us was a pretty seamless transition. So that was not anything that was too terribly new there. Bid openings and proposal assessments, now that was a different story because we do, still have to have the public bid openings. So now what we have done is our legal teams and everybody have gotten together and collaborated and said, well, the way that we're going to handle this is if we have something that's already published right now, we're going to issue an amendment to that solicitation and allow for a conference call participation to bid openings. So if you wanted to participate in a bid opening rather than coming in person, you can actually pick up the phone and call and be a part of whether it be a paper offer being submitted or one that's through our e-procurement system and electronic offer. You can still hear the same things that you would hear as if you were there in person. So that is a helpful way of doing that. I've talked to some other agencies that have a requirement to be able to visually share that, and many of them have gone now to publishing and doing a live feed, whether it be Skype or Zoom or those type of things of their actual bid opening process so that they can meet that requirement. So hopefully that is also helpful.
Hey,
purchase order processing, yeah.
Stacey, who are you using
Go ahead,
at
Rick.
the state for? Who are you using at the state for to handle those bid openings?
Well, we have labeled our, essential and non-essential personnel. And so we have those warriors that I say remain on the front lines that are there to receive those paper offers that as they come in. We also have some that are supporting from home. So as we have a bid opening, we still have at least 2 people that come in and we phone a friend if we need an expert that is typically the one that handles those type procedures. We call them and dial them in from home to help, guide through that process for those that may not be as familiar with those day-to-day handlings that our typical team in the office is. But we do actually literally have people that are still in the office that are trying to keep business as usual with that social distancing in mind.
Gotcha. Okay, thank you.
Yep.
Hey, Andrea, let me switch to you from a kind of a local school district perspective. How are you handling this solicitation cycle, bid openings, et cetera?
Well, actually, on March 12th, when they unexpectedly closed our schools, and then subsequently on the 16th of March, when they reported that the only ones that were to come into the office were essential personnel as well as directors and above, we actually had 3 solicitations on the street. The first thing we did is we issued addendums to extend those solicitations another week to give me an opportunity to wrap my head around this, because like I said before, unlike some of you, we had no plans for the unexpected events that take place, such as this event. So what we did is we actually had recently purchased a system to help us do online bidding. That was only set up for our IFBs, but what we ended up doing is we were able to set up a way that we could accept electronic RFPs in that same platform, and we just put a bid closing date and time in there, so the vendors had up until then to upload their documents. So through emails, that helped us a lot. On the bid openings, due to the timing, we actually had 3 paper bids. I was in the office at the time, and so I was able to get those bids. I've opened them, and we require that vendors not only submit bids on paper, but they also submit an electric copy on USB drive. So on the USB drive, we've been able to utilize Google Docs. We upload our documents into Google Docs, and then the evaluation committee goes in there to review their documents. And in the case of our 2 RFPs, the evaluation committees are able then to meet through WebEx, Zoom, or some other platform and hold their evaluation committee meetings. And we're also getting ready now, the first week of April or second week of April, to do our vendor demos or interviews through a Zoom process. So that's really how we're handling it. Fortunately, we haven't had any yet that require pre-bid conferences. The other example was we do have some facility bids that may require site visits. Now with the site visits, we're able to do the site visits as construction and contract work is still continuing out here. But that's another area we need to take a look at on how we would handle that if in the event, you know, the stay-at-home order includes those construction contract workers as well.
Yeah, excellent. And, you know, it's not only just doing the solicitation, but a couple of questions that we received about how you're dealing with deliveries. Do you have an active warehouse? Who's receiving, accepting, so the payment occurs? So I'm kind of interested in hearing from the panel about this particular area. Linda, you want to provide some insights?
Okay, I have been monitoring. I'm on the Insight C19 communities, so I've been watching some of the things that have gone through there. I guess the biggest thing is to determine your essential personnel, who they are and where they are and what deliveries would come into them. That goes hand in hand with reviewing your supply contracts or your service contracts that you have out there and determining what's going to continue on and what's going to take a temporary hiatus if that's a possibility. Keeping in mind that force majeure isn't a get out of free card just because there's C19 or some other pandemic. There's still some responsibilities there, and your mission critical contracts you can't really let get away. So being able to deal with this is a big thing. The first step in my mind is communicating with your suppliers, especially the ones that are mission critical, and having a discussion with them about how they manage their deliveries, what access points you're going to have for them, the times that you can have staff there. If they're using a carrier, is there some process that you can set up so they have to phone first or make an appointment to deliver, that sort of thing? It's kind of the obvious one. But there's also now in some cases drop and go deliveries where they just drop it at your dock or wherever you tell them to drop it, and then you sign for it and scan the document and send it back to them. So it's kind of a delayed acceptance that flies in the face of under the UCC of when acceptance occurs. So you're going to have to look at your contracts and see whether or not that's actually an opportunity for you, or if you can set up a pandemic waiver, or even if it's under your emergency measures protocols. One of the other things that you might consider, and I did this at the hospital, we had two suppliers who were, they kept us alive during the SARS pandemic. We actually had a fleet of delivery trucks. We also had some people who use their personal vehicles. The only caveat there is you're going to have to make sure that there's insurance coverage, because that's a whole different can of worms that you're opening if you're using personal vehicles. But consider doing a pickup versus delivery. This means that you know, you could be able to get things in small quantity. Now, obviously, it's only going to work if they're within, you know, some manageable driving distance. Or maybe you contract with a carrier of your own to actually go and do the pickups. But think about the options that are there. It may not be the standard routine method that you would use. But you have to marry it up with your contracts and what your delivery terms are in your contracts and your delivery methodologies, and see how you can work that out. And it will be different with each supplier. So my suggestion would be to focus on the mission critical suppliers first, and or ones who are in the middle of something that needs to be massaged somehow.
Right, great advice, Linda. I'm thinking about as you look at all of the items that you procure, some of these can still work on that cycle, but others, I bet you have to put some kind of procurements on hold because it's not mission critical, et cetera. So, Carrie, any insights on what you've had to put on hold, maybe because you can't manage them remotely or because they're not mission critical? Thoughts on that?
Yeah, so much like some of the folks that are on the chat, we're not an entity that had an e-procurement system fully implemented. We actually are writing an RFP and getting ready to issue it within the next 30 days. So the timing just didn't really work out for us well. So we still have a manual intake process. And so some of the guidance suggestions that Linda shared is really, really helpful to us to consider interim solutions, and what Andrea shared as well in terms of how she's handling evaluation. We find ourselves currently with 30 active solicitations out on the street when this happened. Those are goods, services, construction, and professional services. Like some of my counterparts, we pushed everything out for 30 days just to give us some capacity to try to figure out, how we're going to handle this. We canceled or postponed all of our pre-bid meetings, and so for any that might have had a mandatory pre-bid because of security access reasons to get into a place like our jail, for instance, or back of the house access that maybe doesn't have the ability to lend itself to public access, those remain on hold. Luckily, there's not very many of those, but we're going to have to kind of contend with that as a separate piece. For the non-mandatory ones, we're considering migrating to virtual pre-bids via our WebEx solution, but for any that are mandatory, those are on hold right now. We were directed to just cancel or postpone any of our openings right now because of our public requirements within our county ordinance. So we're trying to kind of contend with that too. So we're in a space right now where we have 30 out there, and we're just trying to kind of navigate potential solutions that we can consider to at least keep some of them flowing. We recognize not all of them will be able to keep flowing. For any of our requests for proposals that require an evaluation process, our county attorneys have said that those have to comply with Sunshine Law, and so we're going to kind of handle those separately. Yes, our governor has provided some guidance that exempts Sunshine Law or allows it to be handled virtually, and so that's kind of the second phase of what we're contending. Right now we're working on getting our bids flowing, making sure we have an electronic means to intake them. And then the second phase will be facilitating the evaluations of those RFPs to kind of keep those flowing. So for right now, the RFPs especially are on hold, and we can't kind of affect those evaluations and move those forward. So for all of our solicitations that were already open and in some sort of process, we're tracking all those irrevocable offers. So for our IFBs, we had 90-day irrevocables from the time of opening till contract execution, and our RFPs, we had 120-day irrevocables. And because those scoring meetings have now stalled for a period of time, we're really having to track those, make sure we're within those parameters of the irrevocable offers. And it really could be impactful if we're going to be faced with longer timeframes to be able to get to the contract execution phase. So what that really could result in is some of our offers declining to extend those irrevocable offers, and that's going to then, reduce our competitive requirements that we were complying with. So we're currently contemplating if we need to modify our standard irrevocable offers for the foreseeable future and maybe extend those out. We're also looking at an interim solution for an electronic response intake. So some of the e-procurement platforms out there are offering free licensure for a period of 4 to 6 months. So we're kind of vetting that process to at least give us a secured electronic portal for people to be able to submit their responses to us. So that's something that we're currently working on now. We've got some people that already came in and dropped off hard copy bids for some of those, so it can't be completely electronic because we've got people still mailing them in or coming into our office. They weren't realizing that we extended bids, so we're kind of contending with the hybrid also. If we go electronically, we've got to still address the submittals that have come in electronic or hard copy. But executing those contracts is something that we're on hold for construction-wise now because we have a Florida statute that dictates that when we have performance and payment bonds, that before any work commences, they have to execute and record in the public records of the county where the improvement is located, their performance and payment bonds with the surety authorized to do business in the state of Florida. So we have to make sure that we're complying with that Florida statute in terms of how those bonds are getting recorded, and we have to ensure those are recorded before we execute the contract. So we're working with our risk management team. They're coordinating with their surety representatives to determine if contractors have the ability currently to record the bonds electronically. It's just something we don't know. We haven't had to contend with that before. So it's a hurdle that we're dealing with. We hope to get some timely guidance so that those construction contracts that are kind of in limbo pending execution and submittal of those bonds can move forward as well.
Gotcha. Boy, there's a lot of intricacies here, right, and things that you can and cannot do necessarily remotely, and some challenges in terms of delivering those services to our constituents. We honestly wanted to talk about applying for disaster relief, and folks, I know that a lot of you are just very anxious to hear about how do you meet the demands for sourcing, et cetera. So I'm actually going to skip this one if you don't mind, but we obviously have a few topics for our next time that we bring a panel together to talk about C-19, because I think this whole issue of how do you apply for disaster relief, I think is absolutely critical. And we also know that the communications are kind of a big area, and maybe we could just take just a brief break with the panelists. How are you managing those communications, particularly with suppliers? And we already talked about you within your own department, but with colleagues and suppliers. Any little quick tidbits you can share with our audience and how you could most effectively manage the communications piece?
Rick, this is Stacy, and I wanted to mention something that we are doing to help facilitate, because as many of us can relate to, there have been a whole new set of suppliers that have just come out of the woodworks that we're not familiar with, we've never heard from before, and they're offering all of this PPE and this critical equipment that everybody across the world is needing. And so what we identified was there's got to be a way to vet these through the process and decide if this is, a credible supplier as well. So what we have done is we have developed a team, and I put together a training with them on some different places to look, at sam.gov, looking at Dun & Bradstreet reports, trying to see, do we have any existing relationships with them, looking at Secretary of State registration, those sorts of things that you would typically do in a standard responsibility determination. And we are tracking those in a spreadsheet that we literally publish on our forward-facing website at the end of each day or the beginning of the next day for those that are in high demand and just trying, I've got to have it right now. I don't care if you're a hospital, I don't care if you're a state agency, I don't care who you are. It's a way that we've done at least a baseline vetting of a variety of suppliers that are just randomly reaching out to us and putting it out there so that we can work smarter and not harder by collaborating with one another and making sure that we're making good decisions and we're not, sending $1 million up front to a vendor that's non-existent, right? Not that we would typically do that as good professionals, but it's important to be able to vet that. And so that's one way we have opened up communications, within the industry with suppliers and other departments and even private sector.
Right. So that's a beautiful segue into and how you're supporting your constituents, and particularly the first responders and the PPEs and all of that equipment that is absolutely critical in the next 24 to 48 hours. So it's a whole issue about how you support the role of public procurement in your strategies. Andrea, from a K-12 standpoint, how are you doing that? And then we'll start shifting in terms of how folks are doing some sourcing.
As far as how we are supporting the strategies, it kind of goes into what I had mentioned before in regards to we as directors are meeting with our appropriate assistant superintendents who are communicating the information to us from their level, from the superintendent. In regards to the school board, it's been a work in progress because, as many have said, policy and procedures dictate how they can meet, how often they can meet, what constitutes a quorum. And what we did is we needed to wait until the County Board of Supervisors adopted a process. And so tonight will be the first night. We're having a special meeting tonight where they're going to allow public comment be submitted electronically. And then each of our board members is going to be located remotely along with each of our cabinet members in order to communicate and conduct that meeting. So just like with any other communications, a lot of it's been done through emails, newsletters. We have also, the community is a big part of this, and we've set up a front-facing web page with frequently asked questions to answer the community's questions, which in turn are the parents of our students.
So you are in constant communication with your direct reports so they understand how procurement is supporting their work at the schools.
Yes, we're in direct communication. Yeah. I'm in direct communication with each of my fellow directors regarding what the steps are going to be and what the processes are going to be going forward.
Right, and Carrie mentioned that she's been working in the Emergency Operations Center, the EOC, for a period of time. I think it's absolutely critical that you are working with your direct reports. I think the big issue here, that other kind of like that 500-pound gorilla, is resourcing demands. So what are you doing in the sourcing? What are you doing in terms of utilizing cooperatives? Let's live with sourcing first. So I think Stacy had talked about, you've got all this demand for masks, et cetera. Those sources, how do you know that's the right sources? Carrie, some thoughts on how you would making sure that you're getting the right equipment from the right sources. What we call the 5 R's in public procurement, right?
Yeah, and so at our Emergency Operations Center, our procurement folks are supporting Emergency Support Function 7 for resource support. So we're running 12-hour shifts 7 days a week over there to support any of the needs of the county and associated partners such as the Sheriff's Office and things like that. And so, of course, just like the rest of the country, like the rest of the world, we're all kind of contending and we're in a global sourcing competition, if you will. We're all looking for predominantly the same type of equipment to support our medical folks. We're looking for disinfecting solutions like the hand sanitizers and wipes. We're looking for the masks. We're looking for protectant coveralls. We're looking for the infrared body thermometers that will measure your temperature. Our folks have resorted to building their own collection kits. So because collection kits are really not available, at least not widespread, and we have one of the 3 drive-through testing centers in the state is stood up at our convention center. That's being run by the National Guard, but our health services folks can't wait for kits to come in. So they've started resorting to just building their own kits and buying the unique pieces that would comprise a collection kit. And so we're sourcing things like the nasal swabs. And we're sourcing different pieces of equipment like isothermal systems for rapid indication of qualitative infectious diseases, and they provide molecular results in minutes. So different type of technology and solutions that might be out there in the marketplace that we don't usually source for. But one of the great kind of, if I can give a plug here, because Rick, this goes back to what you were talking about in terms of how do you communicate. The Insight group for coronavirus, if you're not already a member of that, I would encourage you to become a member and join that today. There's a lot of great information sharing there, and I've been taking advantage of some of the sourcing that other people are posting on there where they've found things. And Rick, you've provided some great links on there for certain repositories of different contract and sourcing that you can use. And I've taken that information and built a large master sourcing sheet that we can use to source our needs. So please use the Insight group. I think it's a great resource. But one thing I would caution is that, and I've been working really with some people around the country that are reaching out to me specifically about this, is the challenge, and Stacy alluded to this, that we're inundated with unsolicited potential sources saying, hey, I have 2 million masks, I have, this bulk of gloves, I have these masks, I have, wipes. How do you know they're legitimate? What are we doing to vet them? We have been told by some of our surrounding agencies that they've been scammed. They're relying on the fact that these people they're hoping are good, honest, upstanding folks, and that they have products that they desperately need, and they're unfortunately falling for a scam. So I would encourage you to have a centralized repository for people to be able to submit if they know of a potential source, so that you can go through a vetting process. And if you're not centralized, then perhaps you as procurement can provide some general guidance to your department so they don't fall into these traps. We always ask them to provide manufacturer specification sheets. And sometimes when we go back and ask for those, we never hear from these people again. Sometimes they'll ask, what is that? And so we know if they're asking what a manufacturer specification sheet is, they're probably not a legitimate company we want to consider. But others are providing that documentation. And so when we get it, we're forwarding it to our ESF8, our counterparts over there at Health Services, so that they can really evaluate it for quality. They can look and see, is this a legitimate, based on the FDA approval on their manufacturer spec sheets, is this something we even want to consider, or is this not a viable source? Take a look at your division of corporations to make sure that these folks are registered, actively registered to do business in your state. Take a look at that SAM.gov to make sure they don't have any federal exclusions, because remember, if you're going to seek reimbursement for some of these things, you still got to comply with the federal procurement standards. Consider the payment provisions that they're indicating to you. We've had some folks that say they only want cash up front. And so that's obviously a no-go for us. We're not considering anybody that's requiring cash payment in advance or any deposits in advance. So we're communicating to them what our payment terms are. Some folks are recommending that you check references. I'd suggest that that may not be practical in an EOC environment. It might be kind of difficult to evaluate in a timely fashion if you're talking about emergency type of situations. But these are all things to consider when you're looking at the responsibility of a company. How are you vetting them? How are you considering these folks that are just really, they're coming out of the woodwork, and we are inundated. In Orange County, we are completely inundated with this. I spend more than half my time at the EOC vetting potential sources of supply that are just coming in left and right at me. Our health services folks have really taken an approach of, hey, we have a responsibility to try to obtain competition. If we can't obtain competition that's quality or that will meet our timeframes, then they're just using the process of requesting resources up through the state. And so our state of Florida has provided us what's called a COVID-19 emergency requisition request form to our EOC. You are required to validate and document the vendors that you contacted. You have to provide details in terms of your current inventory, what your burn rate is, what your projected outage date is, what the projected delivery dates are for these quotes, for these sources, and you have to upload all of that so that they have documentation to support that you've at least attempted to do your due diligence to obtain quotes. So when all else fails, know that you can rely on a state resource request if you need to. But please, 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 I can't express enough, please make sure that you're doing some sort of vetting of these folks so that you don't get burned like some of our counterparts have.
Right, and I see a lot of chat on the Zoom, so make sure you're watching that too. Jack's got some great points and things that you need to watch out for. I think this is really, really critical that when you're sourcing with these precious tax dollars and the need to get this equipment out quickly, that you are getting the sourcing from the right suppliers. And there was a couple comments about Insight. I'll show you that at the very end, and they were really pushing on time. Very, very quickly, I know that some of you are relying on cooperatives to manage that process, or well, at least to be a resource. So I don't know, Linda, have you had any experience with cooperatives that are able to fulfill some of these PPE requirements?
Yeah, actually, I'll be really quick about this one because there are a lot of cooperative contracts out there. I guess one of the things to look at is if you're looking at whether it's a federal or a state provincial contract, where do you stand in the line as far as your status for emergency supplies? So for example, when I was at the hospital, we were a chronic care. Acute care hospitals were in line in front of us, so we were second in line. So in this case of C-19, you're looking at healthcare, first responders, that sort of thing, who are probably going to be first in line. So just know where you are in that queue, because it may mean that you cannot rely on those contracts to actually, and those suppliers to be able to deliver to you. The other thing is, don't forget about your industrial supplier options. During SARS, we had one of our industrial suppliers that were able to provide us with alternatives. So they had biohazard jumpsuits and painters, Tyvek suits and that sort of thing, which we used as an alternative to isolation gowns because it did exactly the same thing. If you're looking at the chat, you'll see that our provincial and federal governments are looking at suppliers to either ramp up their production or do alternate production. So we have a bunch of distilleries who are producing hand sanitizers. I mean, after all, to be effective against C-19, there's 70% alcohol. Who are you going to go to for alcohol other than a distiller and a brewer, right? And they have the bottling capabilities, so it's relatively easy for them to retool. Here in Canada, we've got the benefit that the federal government is stepping up and doing a lot of the stuff and a lot of the contact, and it falls downstream to the provinces, and then we tag on to it. So I think that's a fairly significantly different than what you're experiencing in the US. I don't know that you've got that same coordination going on. I could be wrong about that.
Yeah, so part of the challenge really is this whole thing of of what happens when your supplier that you've had a contract with no longer can provide for you. So what are your other sources? So
yeah, the other thing post SARS, and this is whether it's post SARS or post Katrina or whatever, a lot of agencies that I've dealt with, not just the ones I worked in, but ones I go into as an instructor as well, they're splitting contract awards. So rather than doing 100% with one contractor, they may award 80% to a primary and 20% to a secondary, particularly if they're in a different area of the country. So you may need to pick up a little bit of extra shipping costs to get it to you, but it may mean that you've got an alternate source of supply that if one can't deliver, the other one can. Or throw yourself on the mercy of some of your current suppliers. They have ears to the ground. They know who's producing. They can tell you who's who's a stand-up supplier and who isn't, and leverage that. I mean, they'll find people. I had a mask supplier that one of my interior suppliers found me in Edmonton. I would have had no way of finding them in Edmonton, but he phoned me and said, if you want masks, he's got a truckload coming in today, call him now. So they can be a huge resource for you.
Not kidding.
Yep.
As it relates to that continuity of service, though, because you need to get the supplies, equipment out, and your source has kind of dried up. Jack, what are you doing with that? What are you doing with continuity of service issues?
Well, let's see. A lot of the things that were just said, we had a lot of breweries in this area, and I already have 2 that are producing hand sanitizer to World Health Organization standards. They put a recipe out, and I actually have 1,800 gallons on order that will be here next week. Additionally, supplies like hospital, I'll call it, it's called surgical masks. So they're not the N95 masks, but they're a barrier for surgery. We have started to have local volunteers we have a pattern out there, and people are making their own masks in some cases. So we've really kind of, I'll call it, look to our community to bootstrap ourselves, because we're all chasing the same supplies, and quite honestly, it's all coming from China. That's another topic for another day. But my one comment is, please, 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 let's not pay exorbitant prices, because we're all competing for the same resources. There are priorities. Healthcare needs come high on that list. Make sure your organization is properly classified. Like someone said earlier, my delivery addresses may not reflect that I have hospitals, primary, very serious elderly care facilities. Your address isn't in their system to get that priority. So double check those, and please do us all a favor and not pay exorbitant prices, because it hurts all of us, or exorbitant terms. So I'll shut up.
Yeah, Jack, I just want you to push on a little bit on that about, because you mentioned this, I think, in your other post about how do you detect fraud and how do you report it?
Well, let's see. How we detect it is very simple. We do follow up on every. I said it the other day that I chase rabbits. We get referrals that through our supervisors or our website that says, hey, I know a guy who knows a guy that has a special relationship and can get you a tractor trailer of N95 masks. So what was mentioned earlier, we have a team of people that on my shop that are vetting those offerings, and then right up front, we're having the conversation with them that in California, it's against the penal code to be 10%, to charge more than 10% than what your prices were 2 weeks ago. And I think it was made earlier that, there's a lot of people out there that are trying to make a scam. And so our district attorney has gone on the media and said they may be working remotely, but they're interested in pursuing folks that are price gouging. As a matter of fact, there was one gentleman that had a garage full of Clorox sanitizing wipes in his garage, and he put it on Craigslist, and guess who showed up? The DA, and he was arrested. So those, you know, if one of us starts buying from those sources, it negatively it undermines the integrity of our whole procurement process across the nation. So.
Yeah, and just as a like a commercial, we at NIGB are currently working with U.S. Department of Justice on producing a separate webinar, particularly on this issue of procurement fraud in the supply chain, and we hope to release that in the next couple of weeks. We're working with DOJ and they're called their Procurement Strike Force Commission. So look for that as well. Real briefly, let's just wrap this up. They're talking about, you know, at some point, COVID comes and goes, and we're left with challenges on our budgets and resources. What are you seeing in terms of both the immediate and short-term impacts on budgets? Andrea, let me just throw that out to you.
We actually are in a spending freeze as we speak. With the exception of grant funds and our capital improvement program, our new building construction. That freeze took effect the 20th of March. At this time, we're looking for the freeze to remain until the end of the fiscal year. Our greatest expenses right now are personnel costs, both trying to pay our what we call our long-term subs, as well as our permanent part-time employees, as well as pay for those that are still going into work every day, not being able to work remote. So with the unknown of our personnel costs, and plus the fact as a school system and everything being done virtual, there are orders, as you can imagine, that are not needed for the rest of the school year. So we're working very closely with our Board of Supervisors, because they're even looking into FY21 and how is that gonna look with what we're dealing with now in FY20. So in my procurement office, we're currently reviewing all open purchase orders to determine which goods and services will still be needed for the rest of the year and which goods and services can be canceled.
All right, yep. We're really hitting on our last couple of minutes. I know we wanted to talk about, you know, how do we prepare for emergencies and response in this new era of pandemics. I think that's really a topic that we can push to another webinar. I know that our person who manages these programs for us, Laura Shelters, is listening in, really putting up some really great ideas in terms of future topics. This whole issue of competition that we have among ourselves that we typically don't experience, like the competition between state and local government for these scarce supplies. So the federal and state and local, I think, is also a real critical issue. But you know, we're all going to recover from this, but we've got areas that we need to be able to look at, so we're not caught blindsided about this issue of telecommuting and technology, et cetera. I do want to very briefly focus in on NIGP's resources. We talked about them briefly. We have the COVID updates and resources. This is an area with a website where you can see a variety of information that's available to you. We have a listing of the webinars. We do have a link right to U.S. Department of Justice on how you would report fraud. There's issues on sourcing and technology. And then community support we mentioned earlier. There is an end site that's available free for all NIGB members on coronavirus. At last count, there was 157. I bet you that number is going to really increase as we're part of this process. We encourage you to really take this opportunity to share your experiences with each other, because as Terry mentioned, this is where you get to really ask the pointed questions and really get some focus. You know, fortunately, I didn't do a good job of managing this because we're out of time on any final questions. We're going to take the Zoom chat and begin to think about how we can frame the conversation for a follow-up panel. But I just want to take this opportunity to tell Stacy and Linda, Carrie, Jack, and Andrea, thank you so much for contributing to this very, very meaningful discussion. You can reach them independently. You can see their email addresses on the screen here. Again, we'll be able to share this PowerPoint slide deck to you after the conference. And that's it for now. Justin, do you have any final comments?
Yes, thank you. Thank you, Rick. And I'd like to thank our panel. I hope everyone enjoyed this webinar. Please take time to fill out the evaluation survey. A link containing this survey and a recording of this webinar will be emailed to everyone tomorrow. Thanks again and have a great day.
Thank you.